Hello there, I'm Dr. Samuel Grant. Today we're going to talk about a topic that might seem familiar, but in reality, it holds serious consequences if you don't recognize it in time: the early signs of prostate cancer. This is one of the most common conditions among men, especially after the age of 50. However, the real concern doesn't lie in how often it occurs, but in the fact that most men don't recognize the initial warnings. The first signs are often very subtle and can easily be mistaken for typical symptoms of aging or other benign conditions. In this video, I'll help you identify 12 specific signs, from the smallest changes in your daily habits to those symptoms that no one would normally associate with the prostate. And most importantly, at the end of this video, I'll share the most discreet sign, one that's often overlooked during routine health checkups, but actually carries a very high value as an early warning. Before we begin, may I ask, what's your name and where in the world are you watching this video from? I'd be truly happy to know who I'm sharing this video with today. If this is your first time visiting my channel, don't forget to hit the subscribe button and turn on the notification bell, so you won't miss the reliable and informative medical content I share each week. Also, if you have any questions related to men's health, feel free to leave them in the comments below. I'll gather those and address them in upcoming videos. Now let's move on to the first sign, a symptom that's extremely common, but sadly, too often underestimated. Sign 1: burning or stinging sensation when urinating, when discomfort becomes a warning. One of the earliest symptoms frequently seen in men, but also often overlooked, is a burning or slightly painful feeling when urinating. Many people think it's just a sign of a minor urinary tract infection, or simply a short-term reaction to not drinking enough water. But if this keeps happening, especially without fever or clear signs of infection, then the underlying issue could be deeper in the prostate. When the tissue in the prostate starts to grow abnormally or there's initial damage, it can compress the urethra, altering the urine flow and causing discomfort every time you go to the bathroom. Especially in the early stages of prostate cancer, this symptom is rarely obvious, and this mild burning sensation can actually be one of the body's quiet early warnings. If you've experienced this sensation recently, don't take it lightly. Something that seems small and insignificant could actually be the first signal your body is trying to send you. Right after this, we'll take a look at a symptom that seems very common among older adults, but actually has a deep connection to prostate health. My friend, if you're still watching this far into the video, I sincerely appreciate your interest. Please leave the number 1 in the comment section below, just so I know you're still here with me on this journey into men's health. Sign 2: frequent urination, a small change but one worth noticing. If you start noticing that you're urinating more frequently than usual, especially at night, this could be a signal that your urinary system is being affected by changes in the prostate. Many older men believe that waking up 2 or 3 times a night to urinate is normal. But in reality, this might be the body's reaction to internal compression. When the prostate begins to enlarge or forms abnormal tissue, it can put pressure on the bladder, neck, and urethra, reducing the bladder's ability to hold urine, making you feel the urge to urinate constantly, even when there's not much urine. What's worth noting is that this condition happens quietly, without causing obvious pain, which makes it easy to overlook. However, if the number of bathroom trips continues to increase, especially at night, this might not just be a physiological sign, but rather a warning coming from your prostate. In the next sign, you'll see that it's not just frequency. Even the way each urination starts can reveal a lot about your internal health. Sign 3: trouble starting urination, when the urge doesn't immediately lead to action. You walk into the bathroom with a clear urge to urinate, but have to wait several seconds, even up to a minute, before the urine actually begins to flow. This delayed start of urination isn't uncommon in men past middle age. But if it happens frequently, it could be a sign that the urinary tract is being blocked due to changes in the prostate. In many cases, abnormal growth of prostate tissue compresses the beginning of the urethra, the section that passes through the prostate, causing this delayed start, even though the urge to urinate is strong. Some people explain this away as habit or weakening with age, but medically speaking, this is not a symptom to be taken lightly, especially when it appears alongside a weak or interrupted stream. Continuing this journey, let's look into another change, not in the timing, but in the pressure and nature of the urine stream, something many only notice once the condition has already progressed. Sign 4: Weak or dribbling urine stream when pressure goes downhill fast. A normal urine stream in men should have stable and consistent pressure. However, if you notice your stream becoming weaker, not reaching as far, or even just trickling in small spurts, the cause likely isn't just fatigue or dehydration. When the prostate develops abnormally, whether benign or malignant, it can narrow the urethral passage, blocking the urine flow. As a result, urine can't exit as powerfully as before, leading to an incomplete sensation, long-lasting dribbling after you finish, and a loss of confidence or comfort. Especially if this continues consistently and is paired with other symptoms such as frequent urination, difficulty starting, or a lingering sensation in the bladder after urinating. This could be a clear sign of structural changes in the prostate that should be examined as soon as possible. Up next is a change that might seem harmless at first, but is more concerning than you might think, when the simple act of urinating becomes impossible unless you change your posture. Dear friend, if you're still watching at this point, I'm truly glad we're connecting through this valuable information. Are you experiencing a weak stream? Leave a water drop emoji water in the comments if this topic is resonating with your own experience. I'm always here to read and listen to you. Sign 5. Inability to urinate while standing, when posture determines elimination. Many men begin to notice something quite strange. They can't urinate while standing, but sitting down makes it easier. Although this may seem simple from a mechanical perspective, it indicates a change in pressure and flow within the urinary system. In cases where the prostate has a tumor or is enlarged, compression of the urethra, the part passing through the gland, can make standing urination, where body pressure shifts, more difficult or even completely blocked. This is a sign that the body is adjusting posture to cope with internal obstruction. And in the next sign, you'll see something that genuinely startles many because there's nothing more alarming than seeing blood appear where it shouldn't. Sign 6. Blood in urine or semen when color becomes a warning. The appearance of blood in urine or semen is often what scares patients the most, even if it's just a faint pink streak. However, whether it's a little or a lot, this is always a warning signal that must be taken seriously. In certain cases of prostate cancer, tiny blood vessels in the glandular tissue become damaged, allowing blood to leak into the urinary or reproductive system, especially during urination or ejaculation. Pain may not always be present, and it's this silence that makes the condition even more concerning. And if you think what we've discussed so far is serious enough, then get ready for the next sign, when the joy of sexual intimacy is suddenly replaced by physical pain. Sign 7. Pain during ejaculation, when pleasure turns into a sharp sensation. Pain or a burning sensation during ejaculation isn't a common symptom, but it's one that deserves special attention when it repeats. It could result from inflammation, compression, or damage to the seminal ducts or surrounding tissues during the contractions that release semen. In individuals with prostate damage, including cancer, the pain may be mild and fleeting, or dull and prolonged after intercourse. Not everyone experiences this, but it's a clinical sign that should not be overlooked. But prostate issues don't always manifest in the genital region. Sometimes, pain in the back, hips, or pelvis is the first clue. Sign 8. Lower back, hip, or pelvic pain, when the symptom isn't where you'd expect. Many people experiencing back or pelvic pain may immediately think of joint degeneration, ligament strain, or spinal problems. But in advanced prostate cancer, cancer cells can spread to the bones, particularly the pelvic bones and lumbar spine, causing dull, persistent pain that doesn't improve with rest. Unlike mechanical pain, this type of pain tends to be chronic, hard to pinpoint, and gradually worsens over time. While that symptom reflects local spread, the next one reveals how the body's circulation and nerves can also be affected, especially in the lower limbs. Sign 9. Swelling, numbness, or weakness in the legs, when the prostate affects the lower body. When the prostate is enlarged or cancer spreads, it can press against the lymphatic vessels or pelvic nerves, obstructing fluid circulation and nerve transmission to the legs. As a result, patients may experience swelling in the legs, a tingling pins and needles sensation, or noticeable weakness with no clear cause. These are no longer just urinary symptoms. They're systemic consequences of a problem that started in the prostate but has now gone beyond its original boundaries. And it doesn't stop there. Your body might also begin to wear down slowly and silently, as if it's draining energy from the inside without ever saying a word. Sign 10. Persistent fatigue and unexplained weight loss, when the body signals from the inside. Quite a few patients only come in for a checkup when they've been feeling exhausted for a long time, have lost their appetite, sleep poorly, and experience rapid weight loss despite no change in their daily routine. These symptoms are often the result of altered metabolism, as the body fights against the spread of abnormal cells. Prostate cancer, once it has progressed, can weaken the immune system, trigger chronic inflammation, and reduce the body's ability to absorb nutrients and regenerate energy. What's frightening is that this process happens silently, without pain, and can easily be overlooked if we're not paying attention to the bigger picture. And then comes a sign, though rare, that, if it appears, is one of the most urgent warnings that the body is gradually losing control over even its most basic functions. Sign 11. Loss of control over urination and bowel movements, when the nervous system is invaded. In later stages, if prostate cancer spreads to the spinal cord or pelvic nerves, the patient may lose control over urination or defecation, experiencing incontinence, urine leakage, or severe constipation along with numbness radiating to the buttocks and inner thighs. This is a severe sign indicating that the nervous system has been affected and requires immediate medical intervention. Although rare, once it occurs, the risk of irreversible damage is extremely high. Let's now come to the final sign in this journey. Sign 12. Neurological disorders, when the body begins to lose control over its basic functions. When the disease has reached a more advanced stage, the prostate no longer just affects the urinary or reproductive systems. At this point, cancer cells can spread and invade the nervous system, controlling the lower pelvic region, leading to deeply concerning disorders. One of the clearest signs is losing control over urination or defecation. You might suddenly stop feeling the urge to pee or be unable to control your bowel movements. Functions that once seemed simple and automatic now feel distant and unfamiliar. Moreover, some people may feel numbness in the buttocks, inner thighs, or perineal area. These regions are directly affected when a tumor compresses the spinal cord or peripheral nerves. And when this happens, it's no longer just a symptom. It's an urgent red flag requiring immediate medical attention to prevent permanent nerve damage. We've just gone through 12 signs that may serve as the very first warnings of prostate cancer, a disease that often appears silent but can drastically affect quality of life if caught too late. While each sign on its own might not seem clear, if you pay close attention, the repeated or combined appearance of small symptoms is often the body's way of trying to tell you something. And sometimes, something as simple as getting an early checkup or a timely PSA test can make a huge difference to your future health. As someone who spent most of his career listening to and walking alongside men through every stage of their health journey, I understand it's not always easy to admit when something doesn't feel right in your body. But you know what? No one knows your body better than you do. The fact that you're still watching this video right now, that's already a meaningful step forward. If you found today's content helpful, don't forget to hit subscribe and turn on the notification bell, so you and I can continue walking this journey together in future videos, where I'll share more practical, simple, and science-based medical insights for everyday life. Thank you for taking the time to watch. Wishing you great health, peace of mind, and the strength to always take charge of your well-being. See you in the next video.